And with me, I have a Dr. Rajka Milanovic Galbraith, and we are going to be chatting about the genetics of detoxification. So I am going to dive into Dr. Rajka's bio. And so she is a functional medicine MD certified by the Institute for Functional Medicine. She's an international speaker and mentor to practitioners as well as a high performance coach. She helps high performing leaders, celebrities, entrepreneurs, and CEOs regain their energy so that they can increase their performance, productivity, and impact. And she has expertise in anti-aging medicine, nutrigenomics, bioidentical hormone replacement therapy, and peptides. She sees patients at the clinic she founded, Simply Health Institute outside of Chicago, Illinois, as well as leads group online programs. And thank you so much for joining us, Dr. Rajka.
Thank you, Dr. Eric. So so nice to join you here today and your lovely audience.
Yeah, look forward to chatting with you about genetics, specifically genetics related to detoxification. And so before we start with that, would you mind just diving a little bit into your background and how you started really becoming interested in the genetics?
Yeah, so really it had to do with it was my journey and partly it was others' journey. So, like many of us in the field, I've had my own journey and health issues. And what I wish I would have known was how deep those issues went. And so mine did start with thyroid disorder, Hashimoto's. And I know that's a large portion of your population, but I just really wish I had known. And someone would have said, it's not your thyroid. So it really was the dysfunctional thyroid, but it was everything leading up to it that wasn't identified by myself because it took me, the better part of half of a decade to train in all these things. And it was finding that 80% of the patients I could get better with a usual, what we call functional medicine approach. And then you had this 20% residual, like how do you get those people better that were maybe a little bit sicker and not responding to usual means? And I kept doing the deep dive and it led me to the road of nutritional genetics or nutrigenetics and just did studied under a variety of people. And with the first approach, I got an even bigger layer of people better. And ended up with an autism reversal. I know when I say this cautiously. People say, oh, that's incredulous. Like, are you telling the truth? Well, I'm not the first person, and people really need to know that you can get reversal. And of course, it didn't happen overnight. And then it really led me into looking at more and more and more. And the irony of it was, Dr. Eric, is that I looked at everyone else's genetics but mine. I mean, isn't that the irony of it? Although I did a really good job with what we call the epigenetics. And so that's having your diet and lifestyle influence whether a mutated gene actually is expressing. So we do have the power to turn off defective genes. But I didn't really understand all the ramifications. And I wish I would have. It would have saved me 2 decades long of intermittently feeling very, very unwell and ultimately culminating into an issue where my liver enzymes were soaring and they were entertaining a second autoimmune disease. And it really had to do with my underlying detox genetics that I wish I would have known from the first get-go that went from Hashimoto's to infertility to vision losing migraines to PMS to that weight gain that comes. It's seemingly when you hit perimenopause to you name it. And then ultimately this near second autoimmune disease. I thought I had autoimmune hepatitis. And that the statistics on that are that if you are not on steroids lifelong, the death rate is 30 to 50%. So it's very high. And I'm happy to say that by taking the approach I did, never got that formal diagnosis. All the symptoms and numbers, the markers reversed, never ended up on steroids. And that was now over 9 years ago. So, yeah.
Wow, you said 30 to 50% if they don't take steroids?
That's correct.
Wow, that's extremely high. Well, of course, happy to hear that you were able to, avoid the formal diagnosis and, restore your health. And you also said you have a background you were diagnosed with Hashimoto's, then, correct?
Yep, that was the first diagnosis, and it took about 10 years for me to actually get that diagnosis. So that's how long I was unwell. And here's the fear, and I'm sure some of your audience has seen this, as you go to your doctor and you feel unwell, they do the labs. And I know because I was one of those doctors, and they say, your labs are normal, or nothing's wrong, or perhaps you're depressed. And the worst outcome is that they suggest you're depressed and offer you an antidepressant. And that was my fear, is being even a doctor. My labs were suddenly abnormal I used to check them all the time. And I said, well, I mean, they're not really totally normal, but I didn't know what I know now. And by the time I got the diagnosis, the endocrinologist was just a little bit more savvy. And even though he was more traditionally allopathic, he kind of really was switched on to following patterns. And he said, you've had this for 10 years. Look at these antibody levels. And it was really shocking, the contrast of how little sleep I needed. So I was going from 10 to 12 hours back to a normal sleep schedule, and how my energy just really soared.
Now, so as you said, the audience, a lot of the audience consists of Hashimoto's, but as well as Graves' disease. So can you tie in like detoxification with thyroid health? Because I'm sure there might be some listening and just not really understanding like how this all relates. And I could also give my input, my feedback if you'd like to, but I'd like to hear, what you have to say as far as the relationship.
Yeah, and I'd love to have that banter. That's what makes these interviews so much fun. So I'd be curious to hear your input. So as you know, thyroid disorder is on the rise, both Hashimoto's and Graves', and you have to say why. And there is a strong correlation to exposure to environmental toxin. We'll just highlight some of the big ones. So perchlorate is found in contaminated groundwater. And that's one of the ones I can measure. And even for people who filter their water, and they may feel like they have a good filtration system. So I'm talking more than just the filter out of your fridge. That's not going to cut it. And more than a Brita pitcher. That's not going to cut it either. And so I found high levels in people who are doing everything right. And then you have to back it down to, okay, if these are all water contaminants, we got to figure out a better water filtration system for you. And then even to things in the environment. So we classically think that the xenoestrogens like BPA and phthalates will affect your hormones, but it turns out they can also affect your thyroid. So what you put on your skin and clean your house with really does matter, to even heavy metals. So all of these can take out the thyroid with a variety of different means and mechanisms. And so what I've gotten very good at and I'm passionate about, I was kind of that nerdy, geeky kid in high school and college, and I just thrived on. I learned all these pathways in biochemistry, but I didn't know how any of them really applied. I even, in fact, have all my notes from the 90s, or gosh, it was the late 80s now. Wow, I'm dating myself, when I took biochemistry. And now that I understand it, it's just so crystal clear to me, like what needs to happen to support first proper detoxification and things we need to be on the lookout for as clinicians if someone is unwell. And you can reverse engineer it, meaning that you can assume things based on symptoms and certain findings and labs. And then, sometimes I like to look at the genetics.
Yeah, thanks for sharing with that. And yeah, I agree. Obviously, the toxins can directly affect the thyroid. You mentioned perchlorate, xenoestrogens. But then also as you also mentioned, it's not just about the thyroid. Especially Hashimoto's, Graves', they're more immune system conditions. And so there's also plenty of evidence in the research that heavy metals and again, xenoestrogens and other environmental toxins can also be at least a contributing factor, if not a direct trigger when it comes to the autoimmune response. So.
Yeah. And I always say you have to remove all the triggers. And I look at about 8 of them, and toxins is one of the 8. But when I speak about detox, I'd love to segue into kind of the general about detox, what people should know. And then one of the areas that I've really found an interest in called oxidative stress. So would that be okay to go on with the general?
Sure. Yes.
So general detox, as you know, we used to call it 2-phase, but it looks like there's 3 phases. And what people don't know is, here's my theory on the whole energy thing, is that the majority of adults and even children, unfortunately, children are probably worse because their diets are just awful these days. If you're eating a standard American diet, they're protein malnourished and they're not getting the phytonutrients they need. And when you measure it, most adults are deficient in 3 to 5 vitamins and minerals, and tops on the list are magnesium and B vitamins. So in phase 1, that takes that chemical, whether it's an environmental toxin, a medication, et cetera, and breaks it down into a metabolite. I always learned it was more active and more toxic, but that requires B vitamins and amino acids. And these are the things people are deficient in. And B vitamins get deplete when someone's stressed. So you start with someone who's behind the 8 ball. they get stressed. And the last 2 years were put many of us to the test, right? Everyone had different levels of stress for a variety of reasons. So they get further deplete. And the interesting thing is that then toxins kind of play a role and take up energy, in that our mitochondria are super sensitive to toxins because the DNA in our mitochondria are not protected in histones. So then you get the environmental toxins taken out and you less well produce energy. And so it's a combination of things. And then, so you don't have the vitamins and minerals to properly detox, and then your mitochondria, which make energy, are taken out by these toxins. The second thing that is really high up on the list for that phase one is amino acids. That's a breakdown product of protein. And almost everyone that comes to my clinic is protein malnourished or has an inadequate protein intake for their weight, for their activity level, and for their age and disease status. So that's pretty profound. And then to go from phase two to phase three, and this is my hero's journey, is, that takes that metabolite and makes it water loving so we can pee, poo, or sweat it out. And it requires one of the pathways, and there's several, is glutathione. And that's where I'm lacking 2 full genes for glutathione recycling. And the third remaining major recycling gene is defective. So I'm really behind the 8 ball in producing it. And so the way to not make glutathione is to add stress to the mix, or live an unhealthy diet lifestyle. So there's ways to boost it. And so that's why I'm really careful. And I look at that. And, for me personally, I supplement, but I know my genetics, and it's not the right thing for everyone to do. It just really depends on the whole story. So I caution people when I say that, is that this was what I determined. So that's generals of detox. And one of the things in detox that will take out our body tissues is something called oxidative stress. And the way I like to explain this is oxidative stress is very similar to when you cut open an apple and it starts to brown as a result of exposure to the air. So it's the browning of our tissues, whether it's our thyroid and causing thyroid dysfunction, our brain causing some memory loss, our joints causing osteoarthritis. And so that's the area I've started to get passionate about, is looking at what causes oxidative stress. And we usually think of that as free radicals, and how do we clear those, and what's needed in those pathways and processes.
Yeah, and oxidative stress, well, like you said, the increased in environmental toxicants, obviously, is a big factor in the increase in oxidative stress. But just again, the autoimmune process as well. I think it's safe to say that anybody dealing with autoimmune condition, whether it's Hashimoto's or Graves' or MS or rheumatoid arthritis, has some degree of oxidative stress.
Yeah.
So you said you're missing 2 of the genes related to glutathione, correct?
Yep, 2 of the genes.
And so would you, when supplementing, if someone's missing the genes, are they still, I assume they could still take something like NAC that converts into glutathione, or would they have to take like a liposomal glutathione or acetylated glutathione or something like that?
Either or, it really depends. So then I saw later kind of some data on the N-acetylcysteine can increase levels of cysteine and further lead to oxidative stress. So I'd say anyone who wants to just boost production, definitely NAC is the way to go. But if you've got known chronic issues, so I'm on a very small dose at all times. So small dose. And then that's what maintains me. And if I ever go through a period of where I know I'm going to be, say, an illness, or, get a viral illness, then I'll bump up that dose. So I'm pretty well versed at kind of turning mine on and off. And I've used NAC too before. I'll add that when there's an acute illness too. But I personally I did not see benefit, but my patients have. So it just depends on where they fall in the spectrum. So moderately unwell probably just need to boost it with the epigenetics, and the NAC would be just enough. And then if you know their genetics and they're deplete. So for all of my chronically sick patients, I've started to look at their genetics, and I say, this is what you need as we're getting you better. And this is what we would need to maintain you, where I'd love to support you to mitigate that relapse, of course, with the whole mind, body, diet, lifestyle, the whole comprehensive approach. So it's not just supplementation.
Yeah, agreed. Diet also plays a big role. You could, eat cruciferous vegetables and other sulfur-based foods. But I guess if someone is really deficient, again, diet's still important, but that's where supplementation might be important. And how about IV glutathione? Are there indications where you ever refer people to get IV glutathione, or
Yeah, it's interesting. Some people don't tolerate any glutathione. So some of my really, really sick patients don't tolerate any. And so you have to be really careful then to give them IV. And and then for some people, IV is not the correct route. And so there's little innuendos with me, and I'm one of that subset that IV. It was really interesting. As I was learning the genetics, I was in between jobs. So we're moving from Boston to Chicago, where we are now, and I thought, oh, one of the benefits of the clinic I work at is that we have IV therapy, and that's one of the perks of the job. And so I did IV vitamin C, which I found huge benefit for when I'm acutely sick, a large benefit that's helped me recover quickly. But I also did it with glutathione, and I'm like, I didn't get that boost. What happened? And then so I had my genetics reviewed with another person that was in the field, and they're like, oh, this is why they kind of cancel each other out. You do far better. And I'm blanking on what that actual process was, but I was just really intrigued that IV may not be necessary. For some people, it's not helpful. And so that's why, I'd undergone, I think, 6 weeks of therapy and then really didn't see a benefit. So I was just really trying to supercharge myself, but didn't see a difference. So
Okay. No, I'm glad you mentioned, yeah, the IV glutathione, especially like some people not doing well, because it would be a bummer for someone to get it. And so it sounds like maybe they should try like the liposomal glutathione first, and then if they, and not to say that
mm,
everybody should try that and then do IV glutathione, but if someone's considering IV glutathione, maybe try regular glutathione, and if they can't tolerate that, that's probably an indication they might not be a good fit for the IV glutathione.
yeah, correct. And same thing. If you're sensitive to a lot of things coming your way or inputs, then there's a high chance you're going to be sensitive to the glutathione. So always proceed with caution, because I've had people, I always say, sometimes in those who are chronically ill, to go slow is to go fast. And it's really a hard concept for anyone who's ever been high performing to accept or follow. And there's nothing worse when we're on the road to recovery and someone goes through the steps at a rapid pace, and they're made to feel worse and worse and worse, but they don't stop. They push through. And then I call it throws them under the bus. And that recovery for me and that client or patient takes almost twice as long as the original recovery. And so I really caution people to um, kind of pay attention to how their body's responding to things, and to have that direct communication with me, how they're feeling. So they're given strict provisions on how to increase.
All right. And then, so nutrients. So you spoke a little bit about nutrients, and you also mentioned mitochondria. And so that's probably a big reason, also, or a big way this ties into fatigue as well, just because with the environmental toxins, affecting the mitochondria, potentially causing mitochondrial damage.
Yep.
And so if you have the environmental toxins exposure, or nutrient depletion, either one of those can have a negative effect on the mitochondria, those energy powerhouses of the cell, which can lead to fatigue, correct?
That's correct. And then you just add in the everyday life stressors, which further deplete your nutrients. So it's kind of like this vicious cycle that can be hard to get out of.
How about as far as the gut? Because also, I mean, all this is important, but the gut, obviously, if you don't have a healthy gut, that also could lead to nutrient deficiencies, even the amino acids. You mentioned the protein, which I agree, people do need to eat sufficient protein. But also, if someone has like low stomach acid or other gut issues too, they need to address that, or else that could be a big problem when it comes to, detoxification, supporting the detoxification pathways as well, correct?
Correct. So you already mentioned the first way is that we absorb our vitamins and nutrients, the amino acids, less well when you have dysbiosis or low production of stomach acid. So both. And so that puts people even further less well able to tolerate being exposed to toxic substances. And then, ironically enough, I was kind of re-reviewing things with phase 3 detox, that the dysbiosis will not allow you to do that phase 3. So excreting it, transporting those toxins out of the body. So you have to really pay heedance. And I do have I call it the right order, my 3D protocol. So I do things in the right process, so that if you go in and you detox someone from the get-go as the first starting point, you can make someone very, very sick. So it's never the first thing. And I always tell people a diet will detox you. And I had one woman in all these years who ate so terribly that when we put her on a healthy diet, she complained vehemently. So she was gently detoxing, but really felt the effects of it because she had never ever provided herself with the right nutrients. So I think she was probably getting a backlog of those metabolites and not able to clear them as well. And so we had a back step. So even sometimes diet can, but that was like that's a rare case scenario, but it's the right order too. I've seen people be made a lot worse if they're detoxed first and not with all the support systems in place.
So really you need to make sure phase 3 is working, which makes sense. If you're constipated, you probably don't want to get aggressive when it comes to, detoxification.
Yeah, correct. So, having the appropriate nutrients, having amino acids, making sure there's NAC, glutathione, making sure that someone is sweating and hydrating, and then having daily bowel movements. So, yeah, you're right, and not being constipated. I always laugh and I say it's the only field where talking about poop is kind of sexy. is our field, right?
Yep. No problems. Talk about poop here and to our patients. Now you said when you were giving your background that you had your gallbladder removed, and which unfortunately happens to a lot of people. And so a couple of questions with that. I guess one question is if you take any support since you don't have a gallbladder, whether it's bile acids or anything similar. And then also, do you have any tips to prevent someone, like if someone's having gallstones and then their doctor's saying that they need to remove the gallbladder? Again, not to say there's never a time and place for it to get removed, but if it's maybe in the earlier stages or middle stages and there's still hope, do you have any tips?
I do. And the backstory there is we were living abroad, and had we not, so we were abroad, and the only American surgeon that was there had left, and we were returning to the same spot. And he had said to me when I was pregnant, I wouldn't operate on you here, non-pregnant, let alone pregnant. And he was pretty much the only, what he felt in his mind, the only qualified surgeon. And I started to have symptoms right before we moved back. And ironically, I had an appointment with a naturopath and with the surgeons. And I panicked because I thought, oh my God, what if I get into a situation where it's an acute gallbladder attack that's like a do or die? And he's telling me he doesn't trust the system or the process there. And so when you have the surgeon saying, oh, you have a gallbladder full of stones, get it out. And wasn't trained like I am now. You're going to probably follow through. Mine was more of a worry of what if. Had I had time, I probably would have done what I do now. And so knowing my genetics, we first want to ensure there's proper bile formation. And the first thing with that is ensuring that we have adequate choline. And choline is a good source, is the yolks of your eggs. Some people have difficulty absorbing choline, and I'm in this mix. That's why I developed gallstone symptoms when I was pregnant. And because I wasn't really producing enough, I wasn't absorbing the choline, and pregnancy increases the need for choline. So I have a whole pre-pregnancy protocol where we do support choline a little bit more to meet the needs of the pregnancy. So that would have been my first port of call, is to supplement with choline, either liquid or capsule form. And I still do that. And then because your common bile duct, which is what remains, does produce a little bit of bile, but I augment and do bile acids or bile salts, so ox bile, with every meal so that I absorb appropriately. And here's the kicker. I mean, even that took a little while going into functional medicine to understand that. Say, oh my gosh, I should be on this supplementation. And so from a genetic standpoint, that gene that governs that choline absorption is, just for reference and for fun, PEMT, or the abbreviation for it. So I do have the mutation, and typically you'll see that those with the mutation experience symptoms when they're pregnant and in menopause. And so those are the two time periods. And I had a young lady brought to me by her mom and said, every woman in our family's had her gallbladder out. I want you to spare my daughter. And the daughter was a teenager. So we took a look at her genes, and now she's on gentle supplementation. And we've talked about what you can do. Now, so I'm on those two. Acute attacks can be kind of tricky. So for me, that was also going on at the time of when I had that whole liver flare. And, I just avoided the foods that would trigger it. So the caffeine, the alcohol, the onions, even garlic, I think was a trigger for me. And so I backed off on the foods, and things like beets. So kind of beet juice, beets themselves were very healing for me at the time. And I actually, this last time, I've only had in like 8 or 9 years. And sadly, with the surgery, I had my common bile duct injured and it closed off. And that will make you sicker than anything, because then it really escalates the backlog of everything, of the bile, then the liver enzymes shoot up even higher. And I've had that duct opened twice now. And again, before I was functional medicine. And so now that I rarely get a flare, and I know what my triggers were. And I had one probably like 6 months ago. And you better bet your bottom dollar, stress doesn't help that at all. And I thankfully had a lot of gut healing supplies with me. I travel with a little stash of stuff in case my family gets sick. And just by taking the ox bile, the PC, I even had some colostrum, so which is your immunoglobulins, and even just a good solid enzyme, it passed very quickly. So now I'm just super, super careful that I just try to kind of maintain that, where you strive for a healthy diet lifestyle. For me, I strive 100% of the time, because then when I hit 80 or 90, I'm really on board and doing well. I don't like to shoot for 80, because that means I'm going to hit 60 or 70. And so this way, I have more resilience to things coming my way. And, that's the whole approach. And even from some of my high performers is overscheduling themselves, and really being clear on what my mission and goal are personally and professionally, and sticking to that, and then saying no more than I say yes. So I know that's a little off topic and not genetic, but I think there's that we are genetically wired when you're a high performer and you're, busy and all that, to just want to go and do. But it's probably not the best thing for you. It's probably the first time, I know when I was growing up, it became fashionable, like to go without sleep. It was like this badge of honor or something. And now I think it's just probably not a good health choice to make, and it's fallen out of vogue. So thankfully, in our circles, as you know, sleep is prioritized, and so is preserving your most precious asset, which is time, right? So you can never get it back.
Yeah, no, I'm glad you share that. I mean, I haven't really looked into the research when it comes to like sleep and oxidative stress, but I know lack of sleep will cause inflammation in general, like higher CRP levels, I believe the research shows. So I imagine also oxidative stress plays a role in that too. So no, I think it all does tie together.
Yeah, absolutely. Yeah, and so I look at some other things to know, like there's a level of oxidative stress that is going to be okay. We produce free radicals every time we make ATP, and a small amount of that is super important, because that's how we fight off the pathogens, the bugs we encounter, bacteria, viruses, whatever. But it needs to be in balance. So when it escalates, then you need to be able to appropriately eliminate those free radicals that do damage. And that is governed by genetics. And I look at the pathways and I just love it. I tell people that I've had, a woman who came in with autoimmune conditions, and we did all these steps without knowing her genetics. And then we reverse engineered it. And it was really telling why the steps that I chose based on her history and the symptoms she was having in some of the labs worked. And so that's how I'm able to reverse engineer. So you don't necessarily need it. And in fact, I wish we had a better way to affordably measure like which gene is actually expressing. I always tell people you want to combine symptoms plus labs along with the suspected action of what the gene might be doing, rather than just looking at the genetics, which are worthless just alone. So
Do you look at any tests when it comes to oxidative stress or glutathione? I know like some organic acids tests that look at pyroglutamate, and there's, some
yep.
oxidative stress markers as well, on the Dutch test. If you're familiar with the Dutch test,
Yep.
they have their little organic acids section too that has an oxidative stress marker, the pyroglutamate.
Yeah. So pyroglutamate, what Dr. Eric's referring to, is it looks at your need for glutathione, and it's presuming that your levels of oxidative stress are high. And on the Dutch test, I like one of the ones that you should pay real close attention to is it looks at damage to our DNA. And that marker is called 8-hydroxydeoxyguanosine. So 8OHDG abbreviation. That's not important. But if you have DNA damage that's present, then you better say, what is driving that? Is it stress? Is it toxins? Is it lack of sleep? Is it lack of nutrients? Is it inappropriate diet, dysbiosis? I mean, you just run the list and you maximize as much as you can. The other marker I'll look at is, you can see it on a NutriVal, like lipid peroxidation. So it's damage to the lipids in the body. I look at oxidized LDL, which is the bad cholesterol. So you not only have to have an elevation of bad cholesterol, a portion of that has to be in small particles. And I always say the small particles stick. And then a portion of that is a damage. That's that perfect storm. If you've got elevation, a lot of small particles and they're damaged, then that's the storm for forming plaque and having that plaque rupture. Think about heart attack, stroke, et cetera. And so I've had people come back with high levels. I'm still looking at what's causing it. There's ways that I'll mop that up, so to speak. So there's various things I give if I don't know their genetics. I'll use molecular hydrogen, and that usually will lower it nicely. And then while we figure out, I always say we have to figure out where this is coming from, or we'll never be able to stop it. But I'm going to protect your tissues by giving you this. Now, if I know their genetics, then I'll say, hey, is it a breakdown of that superoxide free radical? And do we need to give you an enzyme called SOD, which breaks that down to hydrogen peroxide? Is it that it's broken down to hydrogen peroxide, but you can't clear it through your glutathione system, through another enzyme called catalase? So I look at the whole big picture, but if I don't know, molecular hydrogen has worked wonders. I don't know about your patients, but I can lower it in about 3 months, and it gives me time to say, what's the source? And that's the most important question to ask. What's the source? Why is it happening to begin with?
Yeah, that's a good point. I mean, if you see any of these markers out of range, you want to know why and not just give the person a supplement. I mean, again, on a short-term basis, temporary basis, it might be important, but you don't want the person to just take, whether it's glutathione or molecular oxygen on a permanent basis. Ideally, you want to try to find the cause of the problem. And then again, I guess that ties into the genetics again, because sometimes we just have the genetic variations, those polymorphisms where someone might need to take some support. And you mentioned a short while ago that you do take, a little bit of glutathione every single day, a small amount, just because of the two genes that you're missing. And so because of this, do you recommend genetic testing to pretty much all of your patients?
I recommend it to definitely the chronically sick and those that really want to mitigate any long-term risk. So the two varieties. Now, some people aren't interested and they have youth on their side. So those in their 20s and 30s may not need it or may not want to know it. So then we really hit the epigenetics, diet, lifestyle. And sometimes just by their markers, I can tell. So let me give you a really simple example of genes. So when we're trying to get someone's vitamin D levels up so they have proper immune function, the range can be a couple thousand IUs a day to 10,000 plus. And those people that are needing 10,000 plus typically have genetic mutations in either the way they're converting or, they're converting or with their vitamin D transport, et cetera. So they're going to have mutations, and there's a whole host of genes that govern that. And so you don't need to know the genes. You just titrate their D that they're taking according to what their body is showing you that they need. And that varies. I always say in the winter, you're going to need a couple more thousand more than you would in the summer. And so far to date, I've had one person, and she was another practitioner, have normal levels, or optimal levels, we should say, without supplementation. But she lived in Austin, Texas. So I thought, well, she's getting sun. And it was so odd. We were living in, the Middle East, and we were out in the sun all the time. That was the only activity you could really do when it was so hot, was swim in the cool pool, the chilled pools. And all of us, me and my kids, all were deficient despite the sun exposure. And so we all have those genetic mutations as well, ironically. And I've seen a pattern where some of my patients who have the chronic environmental illnesses are missing the same two genes I am. And so I'm finding a pattern. And so I'm kind of starting to do some research on like, wow, is that why they're so sick from it? And that's why they succumb quicker. And I do talk about we all have different detox buckets, and some of it's genetics, some of it's the diet and lifestyle. And if yours is small, you're going to present being ill earlier in life, so in your 20s. And then if it's medium, maybe a little bit later. And then if it's large, you might be that one lucky person. And I've had one in a career of over 25 years in medicine where, he's the Uncle Harry who smokes, 3 packs a day and then just dies quietly in their sleep and has no adverse outcome. But that's the rarity, and I wouldn't bank on on that. So
Yeah. Yeah, no, I agree. Unfortunately, my mother smoked for like 40 years and she's still with us. She's 80 years old. Don't really, not, no really bad damage and all that. I mean, don't know still what the next 5, 10 years will bring. But again, she stopped smoking like 10 years ago. So she's not still smoking, but she smoked since she was, I don't know, like, well, actually, anyway, so I'm trying to put the numbers together when she stopped smoking. But anyway, she was smoking for at least 40 years. And, again, her genetics were kind to her compared to others, but you just never know. And, obviously she didn't know. She just was lucky with that. So, yeah, I agree. You just don't want to take the chance. And, the good news, again, there is genetic testing for those who want to find out the information. And like you, I can't say I recommend it to most of my patients. At this point, I won't say new at it because I did years ago the 23andMe, that was around, like 6, 7 years ago. And, and now they've changed that since then. But, and that's intrigued me. And I have recommended some genetic testing. I'm just not at the point where I'm recommending it to most patients. But as you said, if someone's dealing with a lot of chronic health issues, that might be something to dive into and see, especially if they can't tolerate. I'm sure you have people who just, and you mentioned this earlier, there are people that can't tolerate glutathione, but there's also people that seem like they can't tolerate anything, and in that cases, maybe it would be helpful to take a deeper dive into the genetics.
yeah, absolutely. Like I said, the two varieties, so that person who wants to mitigate any long-term risks, because I just shake my head and I'm not going to say it. I'm a firm believer, like your words, your words form your thoughts form your words, and your words can change your life. So, but I shudder to think what would have happened had I not discovered this, because the genes were kind of ominous, and it really just explained. We'll have to do that another time, maybe over a nice dinner or something. But when we're out socializing. But yeah, and so I like it, yeah, for a variety of reasons. And you're right, it's not necessary in every single person. And to speak to your mom, if I may, for a minute, what's very interesting, she must have excellent genes, because we started running an epigenetic test for aging. So it gives you your age based not on your biological age. So if someone's 50, but it measures what have your diet and lifestyle done to you? How old are you based on some of the markers in your body? And smoking is one of the ways that'll age you quicker than anything else, as you know, because it's creating the oxidative stress. So that speaks mountains to that. Maybe you have some really good genes, Dr. Osansky, if they were inherited, but that is one of the 8 things that we would do to mitigate. And we just ran that test on me and my husband just to see where we're at. But the other thing that plays into it is sleep and stress. And so, as you know, the past 2.5 years have been a very interesting time for a lot of us. And I know that I've pulled out all stops, and I laugh and I tell people, I'm like, yeah, when I'm stressed, I double down on the meditation. So it goes from that 15 to 30 minutes to, get an hour in when I can. And it really does help me stay out of trouble as to how I feel and how I recover. Yeah.
Yeah, that's awesome. No, I'm a big believer in mind body medicine. And, what I tell people, for those who might be listening, and, I say this to patients as well, if someone's not in the routine, I say, just start with 5 minutes per day. Just get in that routine,
Mhm.
because I don't want them to think they have to do 30 minutes or an hour every single time. So if you could do 5 minutes per day, get in that routine. And then once you're in the routine, you could gradually increase. And then maybe some days during the week, maybe you will do it for 30 minutes or an hour. And then the other days you only do it for like 5, 10 minutes. But it's
Mhm.
really just with anything, getting into the routine. So I'm glad
Mhm.
you mentioned that.
I
And
like your I like your 5 minutes a day.
well, because everybody could do it. Everybody could find 5 minutes a day. I mean, I know there are some people that find the excuse that they can't do the 5 minutes a day, but those are the people who need it the most. The ones who can't find the time
Mhm.
to do at least 5 minutes. They need to probably do, again, the 30 minutes per day, but at least start with that 5 minutes. Yeah. So uh,
Yeah. I've started saying, what's my bare minimum of the things that keep fuel me? And I have a bare minimum for breath work and a bare minimum for exercise. And it's interesting that when you set that lower limit and you're successful, then you're able to increase it over time. And I've found that sweet spot. And you're right. And another thing I will challenge people is like when you wake up out of bed, hopefully you're refreshed, but say that you don't have the time to even do 5 minutes, do 10 breaths before you even got out of bed. And I've trained so long on heart math is one of my favorite things we teach every single person because the data is sound. And because I've seen people say they've meditated for 20 years and you look at their stress response and it's either in the gutter or through the roof and you say, well, it's not getting you out of fight or flight. So this is a tangible way to test. And after a while, you learn what breath pattern gets you out of flight or flight. So I can do that 10 breaths and know that for that 10 breaths, I'm out of fight or flight. And then periodically through the day, add it. Like think about when you're doing email, right? People breath hold. That's not good. Not only for supplying oxygen and fueling your brain, but just for getting you out of fight or flight.
Yeah, no, thanks for sharing that. Yeah, so if you can't find 5 minutes in the morning or at any time during the day, but especially I agree in the morning, it's nice to start out with meditation. But if you or it doesn't have to be meditation, any type of mind body medicine, any type of but like you said, just 10 deep breaths and yeah, I just actually chatted with another practitioner during just another interview I just did about heart math. We show so she's a certified heart math teacher and all that. So and yeah, I've used the inner balance. I was telling her for many years too. So definitely supportive of heart math. So yeah, thanks for bringing that up. And is there anything else? I mean, you've shared so much great information, but is there anything else I should have asked you that I didn't ask you, or anything that you'd like to share that you were
Yeah,
thinking of? But
I'm going to share three things that keep coming up when I talk to people who are thinking about investing in their health. And, one is to say, to a lot of people say, oh, I'm just going to DIY it, and really to set a time frame. So maybe that'll work in a portion, but to find that guide, and it doesn't have to be me or you, but to find a guide that you trust because it's going to take you from point A to Z much, much quicker. Now, if someone would have told me, so my original guide led me on the diet lifestyle, but he didn't really know all the rest of that. But if someone would have told me, hey, I'm going to give you exactly what you want and get you better from this acute illness, and then I'm going to also give you everything you need, I would have said, all right, I'm all in. Tell me, what is it that I need that I'm not aware of? So sometimes what you don't know, can hurt you. So find that guide, especially if you've tried to DIY it yourself. So I've had people that go away and that if you're having such significant symptoms, and I view that as any level of fatigue, because most people are fatigued and have acclimated to a lower level of energy and they don't realize it. So I'll say that again. Most people have acclimated to a lower level of energy and are already fatigued. So by the time you actually feel it, you're really behind the 8 ball. That means there's some kind of dysfunction going on with that detox that's affecting whether it's your thyroid or your brain or your joints. And so if you've got that, if you've got any where you walk into a room and you don't remember things, those are serious signs, or pain of any sort that seems to not respond to usual measures. That says, hey, there's mitochondrial dysfunction. And that means there's a lot of toxic or oxidative stress going on. And you need to figure that out before it gets into a serious state. And it's just mind blowing to me because I know I can afford help and reversal for people. And when they say, oh, no, that's okay, I'll deal with it in 2 years or something. If you're at that point, you don't have 2 years to wait. You really don't. And I only say that kindly and lovingly because I see people on the other end of the spectrum where they're so far gone. And then it's a real challenge to recover what little you can and then maintain them there. And had they come in even that 6 months prior, 1 year prior. So yeah, just to take some of those symptoms that people tend to write off as more serious because they are.
yeah, thank you. Thank you so much, Dr. Rajka. And where can people find out more about you?
Yeah, so the main source right now is drrajka.com, and I'm sure you'll have that link, but it's drrajka.com. And that kind of gives a wide variety of info. We have an energy quiz on there people can take and resources. I do have a professional Facebook page and Instagram that's also at DRRAJKA. So everything's beyond that thing. We're getting a little more up there with reels and lives. And, as you know, when we're busy clinicians, that goes in waves, but definitely like speaking on shows like yours and podcasts because it's empowering to be able to convey the information so they can see people's minds as to the possibility of how well they can feel.
All right. Thank you. And I will definitely make sure to include the links in the show notes. And thank you so much for doing this interview, Dr. Rajka. Appreciate you sharing your knowledge and expertise, not only just to the genetics of detoxification, but again, you shared so much more. Again, oxidative stress, which I know ties into that, but giving your sharing your story about how your gallbladder getting removed and how you support it, and anyway, just a wealth of knowledge. So again, thank you so much.
You're welcome. Thank you for having me.
All right, so there's a bunch of thank yous here, but yeah, if there's questions, definitely now's the time, for questions. We have a few minutes. Dr. Rajka said she'll answer questions. Let me share some of these comments though while we're getting in the questions here. Okay, we got Patty. Thank you so much for sharing this information. And also adds another layer to my knowledge. And Lori, says thank you. And I have a question for you also. So while we're waiting for other questions, and again, now's your chance to ask Dr. Rajka. So again, I'm going to ask her this question, and hopefully we have some other questions. But what are your thoughts when it comes to genetic testing? And so I mentioned that years ago I did 23andMe, and I converted the data. I forgot what I used. I used Genetic Genie, but then there's other programs like NutriHacker and all that they pretty much give all like the supplements for the recommendations. And are you familiar with NutriHacker? I don't know if where pretty much it gives all the genetics, all the genetic variations, the SNPs, but then for each SNP you have, or I guess depending if it's anyway, it sounds like you know what I'm saying. They'll give like specific recommendations for that.
Yeah, I'd say those should be general guidelines just to be careful, because here's the thing with a lot of the lay public knows about MTHFR, which is, methylation, and you have to be really, really careful with methylation in that there's also a right order for that, believe it or not. And methylfolate and methyl B12 are probably the last thing you'll add, or you'll add them according to their genes. And I've studied under so many people to know this, and looked at how much can people tolerate. And there's small amounts of B12 and folate most people can tolerate, but when you get into over methylating someone, you think about inducing cancers, and so that is a theoretic risk that should be taken into account. But worse would be to make someone agitated or suicidal, and there's a way to reverse it. But ironically, my husband has a mutation and his homocysteine is a little bit higher, and so that's one way we measure to see how well is he methylating. And so I made him, I do med packs for him, so he's a busy kind of guy. You can grab and go, and he's real faithful at taking it. And one day I'm like, man, why is he so agitated? This guy's never been agitated in 20 years. And I was over methylating him, but see, I'm following him. And so we just lowered the dose. But that was really unlike him. And so you really should work with a practitioner who kind of knows what they're doing and can guide you. And fortunately, what I do is I'm not going to over methylate you. And I've looked at a lot of protocols. So there's Amy Asko and Ben Lynch. Amy Asko says, go slow. Ben Lynch says, replace until you feel better, then stop. And so that's a similar kind of thing. William Walsh here is a researcher here in the town I live in, which is Naperville, Illinois. And he looks at whole blood histamine to put people into categories of whether they can tolerate folate or not. And so I've looked at all of that, and I take that all into play. So that's a real intricate balance. So it's not just a one size fits all. But yeah, that I'd say just be careful, but just know, like things like vitamin D, probably not going to get you in trouble unless you're super high in your blood levels for a long period of time. You can leach the calcium out of the bone. So there are theoretic things, but that's a simple one. Or, when I talk about the genetics. So I have a whole weight loss program around the genetics without knowing your genetics. I teach people how to eat to lose weight, and then I teach them how to eat to maintain that loss. And it really focuses on teaching them how to know their genetics without actually testing them. So that's kind of a super cool thing that I do.
Yeah.
And I call it the, genetics and metabolism. It's like your genetic metabolic blueprint. And so we look at so many different things. And so some of those things, when you're just doing diet lifestyle, are safe. Supplementation, just throw caution to the wind rather than just throwing something down the hatch because the NutriHacker said to do
Yeah,
it.
and I agree. I just wanted to, and I figured that's what you would say, but it was more for the listeners, any listeners who rely on, because again, there's a lot of, I won't say a lot, but there's other things out there that, give like a computer generated report. And, some people just will, follow those recommendations, just based, even though it spits out the same recommendations for the same genetic variations. And there's, it's not just the NutriHacker, there's like now microbiome testing. And anyway, so yeah, definitely agree to be careful. And it looks like we do have at least actually a couple of questions. And for Lori, just wants to let you know it will be available it's live on Facebook, so it's automatically recorded. So definitely you could catch the whole conversation. And thanks for tuning into my videos. I appreciate it. So someone from the Facebook group says, can you speak to adrenal burnout leading to Hashimoto's, chronic hair loss, brain fog, constipation, and other symptoms? Should adrenals be supported first before adding other support protocols?
Yeah, that's a great question. My viewpoint on this has changed in the last decade. So that's what we're classically taught, right, Dr. Osansky, like support the adrenals because they'll pull down the thyroids. What I look at is I'll look at the 8 inflammatory trigger, and then I, with the patient, will kind of determine the top 3 or 4. Typically, it's about 3 or 4, and we focus on them. And, they're thinking adrenal stuff. And here's the irony of it. I used to do a ton of adrenal support. I'm not saying I don't. I definitely will support, but it's not the only thing I do. And I'm doing it along with other things. So there's different things for everything that's spoken of in this, in the symptoms, and I can give a little insight into all of them. But so I'll do the adrenal support, but almost everyone that comes in with symptoms is going to need mitochondrial support. And then pinpointing which of these 8 triggers, is it toxins? Is it stress? Is it sleep? Is it foods? And trying to hit those hard first, and then really treating in that right order. I call it the 3D protocol. So we start, obviously, the first D is diet, and then we work through the list. And there's more. It's not just 3Ds. We say it's multi-dimensional. That's the kind of the kicker behind it. But for chronic hair loss, wow, you think about extreme stress, extreme nutrient depletions, possibly alopecia. So you're looking at autoimmune factors. Brain fog is mitochondrial dysfunction, can be toxins. You think about, the whole gamut. Constipation, depending on where you are, food intolerances, SIBO. I mean, there's a whole list of things that can go with all of these. So I'd have to know more information. So it's really looking at treating in the right order, supporting the 3 or 4 areas that need the most support. So if someone comes in, being active and being solitary, so if someone's sedentary and solitary, might be their whole issue, that just resolving that alone is going to help lower their stress response. But they may not feel well enough to exercise. So I have someone in that boat right now who's so horribly unwell. And he says, well, should I push through? And I say, no, don't push through. You can do gentle movement, Tai Chi, some gentle yoga, not the strenuous kind, and, walking to tolerance. But yeah, you shouldn't push yourself until you're replete. And I see about a 50% improvement in symptoms in a 4 to 6 week time period. I'm very targeted and very intentional about what I do. And I've had people say, oh, doc, shouldn't we wait for my labs to come back? I'm like, why? You want to wait 4 more weeks to feel this awful? And I'd say it lovingly, of course, but I don't want them to feel unwell for another 4 to 6 more weeks. I want them to feel better so I can get them to do all of those 8 triggers, or all of those dietary and lifestyle modifications. So they have the energy to do it. And then they feel that when you feel better, you're going to be able to do more. Right.
Yep. All right. Well, thanks for that response, Dr. Rajka. And so Patty says, it's the environmental toxins that I find are the hardest to avoid. I do well with the food and stress management, but chemicals in air, carpeting, cleaners, products in general, overwhelming. Any suggestions? And before Dr. Rajka gives her feedback, I'm sure she also will agree that you can't avoid everything. I mean, there's definitely a lot you could do in your own home, but even then, it's still always a work in progress. But yeah, definitely would love to hear from you, your response to this question.
I love that you said that. So I've changed my tune. I say 40 and older. We all should probably be on a gentle detox agent. If I had to pick one, I'd probably pick humic and fulvic acid. And here's what I say. I say test because first I say implement all the good strategies. And so we think about clean water. And unless you're doing reverse osmosis, and even then, some systems won't pull all those toxins. And it's kind of, you could spend an hour talking about just water filtration systems, but you can test the water. There's tapscore, I think, .com does city water testing to see what's in it. A simpler one to do that's free is go to the Environmental Working Group has a water database and it'll tell you what's in your water. And so we actually tested all of our family's toxins. MTBE, which is a gasoline byproduct, came back high in all of us. So we went right off tap water until we figured out a filtration system. So that's hands down. And I had a high performer who we had recovered 100%. And she's on maintenance. She comes in 1 or 2 times a year. And she said, hey, another doc recommended this test. What do you think? I said, I'd be happy to run it. I love data. And I was super shocked to find that she had levels of organophosphates and the MTBE, and she had a reverse osmosis system and it wasn't filtering. So the organophosphates are your pesticides that typically you think she's eating inorganic, but you can find it in the water sources. So it was strictly for her water. Big other things I found is dry cleaning solvent has been high in wives of the men that do dry clean. So the wives don't dry clean. I found it high in the kids and they don't dry clean. It's the father that dry cleans. So, and it's high in the woman that was high, and her husband took his dry cleaning stuff to a organic dry cleaner. So that's probably not helping, including my husband's, but now we've just gone to laundering his shirts. And so the trick with dry cleaning is ideal would be to air it out in a room that you're not going to be in for 72 hours before you wear it. Too bad we didn't have outdoor sheds that wouldn't pick up odors of some sort that you could store it in until it was safer to wear. So clean water, clean air. So everyone should be filtering. A personal favorite is IQ Air. I love that. So if you don't have a whole house filter, at least for the bedroom, and if you work from home, then remove that unit. Most of them aren't that heavy down into your office during the day. And so if you work in an urban environment, IQ Air makes a filter for your car. So you're going to be getting in those exhaust fumes. So I'm talking about how healthy do you want to get? And so you have to pick and do one thing at a time because it can be very cost prohibitive, right? And then clean food. If you can't afford all organic, look to the Environmental Working Group. They list their clean 15 and their dirty dozen. So then focus on eating only the most pesticide-ridden foods as organic, so that'll lower your cost. Look to outfitters like misfits.com or .com, I think it is, and that's like oddly shaped produce that's organic for a lower price. I mean, there's so many different little strategies you can do. Buy in bulk, or if you're going to buy better meats, go in with someone and do half a cow or quarter cow or whatever produce you're going to do, or not produce, whatever meat you're going to stock up on. Those are just more economical ways. And then so clean water, clean air, clean food. And as far as products, I have 2 sites I reference. One is Think Dirty app. .com. So it's a Think Dirty app is for any of the smartphones. You can literally take your phone and then you can scan the item. And if it's in their database, it'll rank it green, yellow, red. So focus on all the green ones. You can also enter in, what's an appropriate shampoo, and it'll give you a ranking. And you want to try to get the ones that are closer to 0 or 1 and utilize those. But Environmental Working Group also has a skin deep section. So look there. And that's what I've started to. And one tip my health coach gives out, and I agree with, and other patients have said, is it can be prohibitive. I had a makeup bag go missing on an airline. So it was like everything in the front contents of my, I had, those garment bags have the zip portion. So I had all my toiletries in there, and it was hundreds of dollars to replace. And that was before I was as healthy as I am. So it can be hundreds of dollars. So as you run out of a product, research it and substitute it with a better product. But humic and fulvic acid, what I will do is, a lot of people are really high in Roundup, which is glyphosate. I do measure that. I like to test when I can. Is it absolutely necessary? No, but my top 3 secret strategies for those 40 and older, one is some low-lying level of mitochondrial support, because the mitochondria decrease with age. and are prone to the toxins too is some gentle binder that's not going to bind everything up. So nothing freaks me out more when I have like a neighbor say, oh, should I be on this clay product? I'm like, no, you're going to bind everything up and no one's instructed you how to use it. How do you know it's not going to make you worse? I don't, no, you shouldn't just, but humic and fulvic acid really, I'll have people take it twice a day to lower the levels of whatever's in their body for 3 months and then maintain it at once a day. I personally, I don't know what you use, Eric, but Dr. Eric, I use HMAT by Cellcore is a pretty nice little product. And then that's humic and fulvic acid. And the third is then you look at, do we do something for oxidative stress? And I have two favorites. One was that molecular hydrogen that I've talked about. And there's various companies, I like Research Nutritionals, but various companies that sell that, and or even C60 for that oxidative stress. So I've varied. So those are my like top secret 40 and older, what I would recommend if you wanted to get beyond that core 4 supplements. I say there's core 4 or 5 things that most people, most adults, and even probably kids should be on. But if you wanted, as we age and you want to prevent stuff, you can add in relatively safely.
All right. Well, that was awesome. Well, thank you for giving that information. For it really over delivered. Just giving again again. I learned some. Always like when I learn some things during these talks, and I definitely did. And yeah, my younger daughter, she actually had another app on her phone that I never heard of called Yuka. I think it's YUKA. That pretty much similar to the Think Dirty app where you like just scan different products. And I didn't know she was scanning everything we were bringing in just to make sure, that everything was clean, like soaps and things like that, that not everything was clean, that everything was like, got I guess, a same thing. Like if it was in the green, that passed. And it actually gave a score though, like we got soap that got like a 90, which is really good. But then if the, product's bad, it might be like in the 30s or something. And then, so I was impressed that she was actually doing that. So, which I didn't know. But.
Boy, Dr. Ostansky, where do you think that comes from? That comes from that positive role modeling you do. I love it. I love when our kids do that. I really do. And my kids have been preaching to their friends for a long time about, eating the rainbow and all kinds of stuff. And I love that my son is now experimenting on his own accord with intermittent fasting. And we've talked about, he unfortunately had an accident, has a wound that's recovering. And the wound doctor said, hey, your protein needs are really high right now. And so he made me go out and he made some recommendations. So right away I'm at, Whole Foods grabbing some extra meat because, he's a tall guy and 190, so over 6 feet tall. And at 18, my baby. But at any rate, so then I love that. I love when other people tell them to. And I love when they hear from us and then they decide what they're going to do. And we've talked about gentle supplementation. And he's found a way to, he knows because when he goes through a rigorous tennis season, he gets deplete. And as soon as he hit that, I said, well, do you want me to support you? I won't support him anymore unless he wants it. And then and he's like, wow, Mom, I feel amazing. I'm like, yeah, that's because you're chewing through all your vitamins and minerals and we got to support your protein better. And I send him with his food and maybe an extra protein shake. And so I love that. What I was saying in that long-winded response is I love that you're that positive influence for your kids. Well done.
Yeah. Well, thank you. Thank you. I had no idea she was doing that, but yeah, I was impressed too. So, and then Patty just has a quick thank you. And yeah, thanks everyone. And especially thanks to Dr. Rajka. Really had a good time today. And, again, I learned some things. I'm sure the listeners learned a lot and definitely have to have you back one day in the future.
Yeah, I'd love to come back.
All right. Well, again, everyone, thank you. Have a great rest of your Friday and a wonderful weekend ahead.